The other announcement is about this Dr. Horst Muller. He is an ENT specialist. He will be coming to Singapore. He speaks all over the world. He is, although a specialist in ear, nose, throat, but because of his experience in working with patients, some of them come to him, for example, and say, I hear my ringing in my ears or things like that. He do all the physical tests, lab tests, what works he could do, and could not find any problem. Then it dawned on him, maybe it's a spiritual problem or a mental or some emotional problem. So he would ask questions. He would ask, is there a turning point in your life, something that changed, something major, whatever? And they would disclose as he asked the correct questions. That's something I want to learn from him, how to ask and probe and ask the right questions to reach the root of the problem. And he's going to be willing to give personal counseling too. So this would be good for those you know who have some relationship issues or whatever. You know, try and see if you can book an appointment with him. He will be here only for like over a weekend. I think it's from Thursday to Sunday. And so this is open to anyone. It's not going to be charged. And they'll just provide some refreshment, I think. But anyway, I would highly recommend attending this because he knows how to draw out principles of life. You know, that if we accept and understand these principles, then life is so much easier. We are free from wrong thinking, you know, cognitive errors, free from wrong expectations, free from a lot of things. In fact, actually, Kathleen has had seen him and heard him and talked with him, and he has been a blessing. And I have heard him myself before, but I'll go again and listen. And so this will be at Balestier Church. The poster is in the chat group. I can put it again. It's in April. Still a ways away. Still, I think April 20th or 19 to 21, 22, around that time. Third week in April. Third weekend in April. So that's something to keep in mind. So that one is in person. He will be at Balestier. So we'll start officially now. The super nutrient power of green leafy vegetables. We are super blessed in Singapore, in Asian countries, because we have so many varieties of green leafy vegetables. When I was in the US, I really miss all the choy sam, kangkong, heng chai, what have you. But there is a lot of goodness to this particular type of food group, okay? Green leafy vegetables. So that's what GLV stands for, green leafy vegetables. So it is a powerhouse vegetable, and there are criteria to determine whether a vegetable or a food can be considered a powerhouse, and it would be if it supplies on average 10% or more of the daily value of 17 qualifying nutrients per 100 calories. 100 calories is not much, you know. People eat what? 1,200 calories is considered a low calorie diet. But again, it depends on us, what stage of life, what activity level, and so on. The impressive thing is that though it is so low in calories, it can be so nutrient dense. Okay, and green leafy vegetables are that way. So this is just a short list of the different good things you can find in green leafy vegetables. They are high in fiber, they are high in folate, they are high in antioxidants, they are rich in vitamin C also, especially if you eat them raw, like the baby spinach, arugula, and lettuce vegetables. Vitamin K, okay, that's needed for your platelet, high in nitrates. Now, vegetable nitrates are not to be confused with the nitrates in animal food that are processed with this red color to keep them from looking dull and brown. Okay, these ones do not become nitrosamine, whereas the additive in meat, like especially pork, sausage, all that, that make them look very red, they will combine with the amino acid in the meat to form nitrosamine. Nitrosamine is harmful for us. Okay, so not so with the nitrates in vegetables. The nitrates actually are good for us to be more energetic. Okay, in fact, beetroot is very high in nitrates, and they have done research study that athletes actually perform better after they have taken beetroot juice or beetroot. But this is not the only reason that green leafy vegetables give us more energy. You will learn other reasons also. Okay, yes?
Will the nitrates in vegetables cause a kidney stone?
Okay, kidney stones may be due to oxalates, but usually in combination with cholesterol. If you do not eat any meat at all or any animal product at all, then it should not be a worry. But if you already have kidney stones, then just go easy on those vegetables that are high in oxalates, which are mainly your beetroot and your spinach. So one way to get rid of that is you don't take the liquid because it is water soluble. So you can actually strain off and still eat the leaves without the gravy. And for people with kidney disease, end-stage kidney disease, they have to be on low protein, low potassium, low sodium diet. They actually keep on boiling, straining off, boiling, straining off, boiling, just to get rid of the potassium and the minerals, and they can still get enough food to not be so deprived. Okay. So it's rich in magnesium. Magnesium is a muscle relaxant. Okay, it helps if you have cramps. Some people have cramps because they don't have enough magnesium in their diet. And green leafies are high in magnesium. But magnesium is important for other purposes also. Okay, it affects your blood pressure also. Likewise, potassium also affects your blood pressure. And usually fruits and vegetables are high in potassium. Okay, phytochemical, this is again a short list. Okay, it's not the whole word. Beta carotene, why is it that beta carotene is supposed to be orange yellow color but green leafy doesn't have that color? Simply because dark green is darker than yellow and darker than orange, so it masks the color, right? You can't see it, but it's there. Lutein, zeaxanthin, all these are important for the eyes. Flavonoids, camphorol, polyphenols, alpha tocopherol, that's vitamin E. Chlorophyll is the green color from the chloroplast, which is very anti-inflammatory. So all these are protective to the body. Okay, there was a research project called the Memory and Aging Project. It's a prospective study. Let me explain what prospective means. It means that you start at a point in time and you go forward into the future. Okay, you follow the people, they call that group a cohort. Okay, you follow them forward in years. You know the starting point, the baseline, what tests you have done, what their blood works, their measures are, what their disease parameters are, and so on. And then you follow them and watch their diet or what they eat, and you see what happened to them down the road, years to come. So there were 960 participants between the ages of 58 and 99 years old. Wow, even 99. These are seniors since it has to do with memory and aging. And they were given 2 or more cognitive tests. Cognitive means brain function tests. Over a span of 4.7 years. Mean, that means can be a little more, a little less. And they adjusted for age, sex, education, participation in cognitive activities, physical activities, smoking, seafood consumption, and alcohol consumption. because all these can affect your cognitive power. So to be fair, that the result has to do with what they are trying to test out, whether green leafy vegetable slows down cognitive decline. Therefore, they will rule out all these other factors which would by themselves slow down cognitive decline. Okay, cognitive decline means you get less and less able to function mentally. Is it clear so far? So green leafy vegetables do support optimal brain function. Okay, and they found that people who ate the most green leafy vegetable each day actually slower down their cognitive decline or deterioration, okay, compared to those who eat the least. And the mean or average number of servings is 1.3 servings a day. One serving is how much? Remember? Half a cup if it's cooked, if it's raw vegetable, greens, then it's 1 cup. Okay? And imagine they had the memory, okay, test for memory. Their memory is actually as good as one who was 11 years old younger. Isn't that marvelous? As we get older, we do become more forgetful, right? But we want to slow that down. And one of the reasons is the B vitamins actually help also to produce this neurotransmitter acetylcholine, which is needed for memory also. Yeah, that picture is a picture of nerve cells signaling to transfer messages. So just about 1 serving of green leafy vegetables a day can slow down your brain aging. And that's not difficult. We can eat green leafy vegetables every day, can't we? And 1 serving, half a cup, that's cooked. That's not much. It doesn't take much. So that's why we're going to give you lots of green leafy later in your salad, in your cooked greens. Okay, so we're going to up our memory today. So this study is found in the European Academic Research, and I quote them. It says that green leafy vegetables have excellent nutritional value, can be used for medicinal benefits because there are different phytochemicals. Okay, now let's give all those names. You can read them yourself because you will get this file. Okay, and all these are protective against diseases, against oxidation, against inflammation. Okay, they are anti-diabetic too. In a health center in the States, for diabetic patients, they put them on what they call a greens diet, meaning for the first 3 days they eat nothing but greens, green vegetables. Okay, after 3 days, then they add one thing at a time, beans. Okay, and then they add whole grains, and so on. That is a very effective and quick way of decreasing the glucose level of diabetics. And it's anti-hypertensive because of the magnesium, because of the potassium, because of the fiber. Okay, anti-carcinogenic means it fights against cancer. Cancer at different stages: initiation, promotion, progression. Anti-anemic means it helps to give you enough nutrient to make red blood cells, like your folic acid, your iron. Okay, it's also improve gut health. By gut health, we mean the type of microorganisms in our colon, in our intestines. If we have more of the friendly or good bacteria, then they protect us against the bad ones from acting up and giving us trouble. Okay, so we have both good and bad bacteria in our gut, but the good should overpower the bad. Lutein and zeaxanthin are 2 phytochemicals for the eyes. Macular degeneration, people who have this at early ages, they are not getting enough greens likely. They're eating too much meat most likely. Okay, L is for lutein, Z is for zeaxanthin. It improves brain function also. It improves spatial memory. Spatial memory has to do with memory of where things are located, okay, space. Reasoning ability, you can think logically, you can analyze problems and solve problems. Complex attention, people who multitask, okay, or need to attend to complex matters. So there is a significant correlation between macular pigment of the lutein and zeaxanthin and also our brain scores. And they can tell, although of course we cannot measure the amount of lutein and zeaxanthin in our brain. We don't cut open the brain to look at how much lutein and zeaxanthin there is there. But because of the correlation with the occipital cortex of the eyes, that you can measure that. And so the indication, the amount in the eyes is indicative of the amount in the brain. Okay, here are some foods that are rich in lutein and zeaxanthin. Broccoli, but the highest is kale, notice. By the way, if you buy kale plant from the nursery or from some shops, you fertilize them. Kale is worth buying and growing because it costs like about say 4 something, but you can harvest from it for 2 years. So it's really worth it. Normally, if you just buy kale vegetable from supermarket, it costs a lot. So, you must fertilize. Our friend here, Lillian, is good at it. Spinach also is very high. This spinach is the picture shown there, the 4 type. Right? All right, so these are just some of examples of vegetables that are high in lutein and zeaxanthin. We'll go on. Nitrates. So what do nitrates do for us? They are good for our heart health, okay? Good for blood vessels and heart function because they improve the endothelial function. That means the inner lining of the blood vessel, okay? Vascular relaxation means, vascular means blood vessel. Vascular from the word vessel. Relaxation, so if your blood vessels are relaxed, more blood can flow through, okay? Then your blood pressure will not go up, okay? People with constricted blood vessel, their blood pressure goes up to get the blood flowing. And it inhibits platelet aggregation. This means clotting of blood in the arteries. If blood clots are in the arteries and if you have a plaque forming there and then the blood clot is go on top of the plaque and totally block the passage, then you can get heart attack if it happens in the heart, okay? Or in the brain you can get stroke. Or if the blood pushes that clot away, it flows and continues to flow until as it goes to smaller and smaller blood vessel, it will clot there and block the flow of blood there. Okay, so that's why it's best not to have blood clots inside the blood vessels. Blood clot where we have a cut externally, that's fine. Or where there is wound that needs to be to stop bleeding, that is fine. Okay, so even nitrates can protect against infection. They enhance the anti-microbial effect of gastric juice. That means the stomach acid can kill more germs and bacteria. They decrease cancer risk of the mouth, pharynx, larynx, esophagus, and stomach, so it's the digestive tract. And they improve the efficiency of the mitochondria, or the power plants within our mitochondria. Okay. There is this alpha lipoic acid which is abundantly in green leafy vegetables, especially broccoli and spinach. And it is also an antioxidant, so it can also break down carbohydrates to form energy. Okay, it helps in nerve pain in diabetics, neuropathy. Okay, so they don't feel severe burning, numbness, and pain in the legs, claudication. Even improves insulin sensitivity, which is it lowers total and LDL cholesterol. Okay, chlorophyll. This is the green color or pigment in the green leafy vegetables. And they can block carcinogens. What is the meaning of carcinogens? It means they are cancer-causing substances, agents of cancer. Okay, and bind to them, trap them so they don't do their naughty work. Okay, good for skincare, good for acne, good for photo-aging. It's an internal deodorant. Do you know vegetarians smell better than meat eaters? Yeah.
It's true.
It's true. Research has shown it so. It accelerates wound healing. It's an antioxidant for chemicals and radiation, UV light. Okay. But we need UV to form vitamin D in our body. All right. We need chlorophyll and light together for our body to regenerate coenzyme Q10. Do you know that you can make Q10 in your body? It's better to make it that way, but you must have sunlight exposure, and you've eaten green leafy, it will do the conversion for you. You know, people take statin drugs for heart disease. Actually, while it does block the synthesis or formation of cholesterol, that process at the same time also block CoQ10 synthesis. So while it block one bad thing, it block one good thing. So what for? You know, we go and get your Q10 from the sunlight. I have a whole presentation on sunlight and how powerful and beneficial it is. It's something I love to share, but not at this time. But anyway, we are going out to the sun more and benefiting from it. You know that by the near infrared ray of the sunlight that you feel as warmth, it's very important that it can form melatonin in the mitochondria of every cell, which acts as an antioxidant because oxidation takes place when food is converted to energy. Okay, so there are always harmful side effects with the use of medication. Another thing in green leafy vegetables is sulforaphane. It neutralizes toxins. It's an antioxidant, so it cancels out free radicals. It reduces inflammation, protects your DNA, and slow tumor growth. So these foods are rich in sulforaphane. Broccoli, cauliflower, you see they are the cruciferous vegetables. Okay, green leafy, kale. Kale is so powerful. But we have kailan today, which is like our Asian kale. Bok choy is bok choy with the white stem and the dark green leaf. Yeah. So that big picture is kale. There are different kinds of kale. This is a curly one. Your cabbage also, both red and white, or green cabbage also, Brussels sprout. And watercress. Watercress is also a very nutritious food. Kale. Yes. Kale is like kailan, a bit like. Okay, people who want to lose weight should eat more green leafy and lots of veggie for that matter. It's not just because they are nutrient dense, but they are low in calories, low in fats, high in fiber. Good source of vitamin K, also which helps to stimulate weight loss. So green leafy vegetables assist healthy aging. We have this telomere. The shorter it gets, the shorter our life goes. So green leafy vegetables actually help delay the shortening of the telomere. Okay, it's shown in the picture there. To preserve the telomere length, and you have more youthfulness as you age. Improves cerebral, that is brain, blood flow. Okay, blood flow to the brain. So you protect you from stroke, right? A Swedish study of stroke risk among men and women found that stroke risk is negatively associated with intake of fruits and vegetables, especially green leafy. That means the more fruits, the more green leafies you take, the less risk of stroke you get. Okay? Your blood vessels will dilate and more blood will flow to your brain. So green leafy vegetables protect the heart because they are high in nitrate, which becomes nitrites and nitric acid, and it dilates blood vessels. Okay? It lowers the risk of coronary vascular disease. Just one extra serving of green leafy vegetable per day can lower your risk of coronary vascular disease or cardiovascular disease by 11%. Okay. There are phytochemicals, there are fiber, there's the niacin or vitamin B3 that does that. Here is a breakdown of how green leafy vegetables lower atheroschlerosis. They also, the fiber will lower the absorption of fat, and flavonoids will protect against low LDL cholesterol, which is the bad cholesterol. Okay, green leafy vegetables lower blood pressure. That's another reason why it protects against heart disease. These are all the mechanisms. I don't think you need to know all this, but you can review it when you look at the notes. So basically, there are many things that are protective about green leafy vegetables. And for diabetics, it makes insulin more sensitive for them. Okay, and it says if you increase an intake of green leafy by just one serving per day, your risk of diabetes goes down by 9%. So that's wonderful, isn't it? I'm so glad I enjoy green leafies a lot. In fact, actually, I feel withdrawal symptoms psychologically if I don't get to eat green leafy every day. Now I will feel like, where's my green leafy? I have to go look for it. Okay, they lower diabetes risk because they are high in magnesium, phosphorus, and protect against gestational diabetes, that is diabetes during pregnancy. Okay, so high fiber is important to prevent the sugar spike. They are low in glycemic index, and they help with insulin sensitivity in the skeletal muscle also. Okay, so anti-cancerous, all these phytochemicals protect against cancer. And these are the mechanisms of how green leafy vegetables protect us against cancer. Okay, so again, I leave you to look through this on your own. Basically, it causes those cancerous cells to commit suicide, so to speak. That's what apoptosis means. Okay, they will burst and die, and then they will be got rid of. Or if the cell is not so badly damaged, they can actually repair. Okay, anti-anemic because they are high in iron, they are high in folic acid, which are needed for making red blood cells. And notice that fenugreek is good for diabetics too, by the way. Fenugreek, you can buy it, it's kind of like a seed. The Indians use it quite a bit. Yes. Spinach also is high in magnesium and iron also. Folic acid is also important for making blood vessels, red blood cells. Green leafies also lower high blood pressure. If your blood pressure is normal, don't worry, it will not bring it down to too low. Okay, it's the antioxidants that are important. It can also control toxins, can be antimicrobial, So you can make tea using like Chinese parsley, lemons together and drink it, or juice and drink it. Okay. Yesterday I learned that your lotus seed, the embryo, the pit that we usually remove, That is very detoxifying. I never knew that. The bitter one, yes, right. And no wonder they say bitter things are good for you. Not necessarily everything. Green,
toxic
yes.
or detoxic?
Detoxic.
I thought people say toxic.
No, she actually made that into a tea for us to drink.
Oh, yeah, the blue color.
No, blue color is another one. That's the blue pea flower.
Another slightly blue.
Okay, maybe she mixed with the mulberry. The green leafy vegetables are also good for your skin, good for your hair. Okay, and they are protective against free radical damage. They are good for the eyesight, especially lutein and zeaxanthin. Okay, and lower your risk for cataract also. So even the glaucoma, which is the pressure in the eyes, actually lower it. Good for your bone health. Can you imagine? All these minerals, calcium, magnesium, vitamin K, are needed for bone development. Good for digestive enzymes. Okay, keep the gut healthy. Kill bacteria that are harmful to us. They are like prebiotics, and they help form good bacteria in our gut. So these are more reasons why green leafy vegetables protect against or are helpful to our friendly bacteria in our gut and prevent constipation. Okay, can help fight against inflammation and oxidation. So this is a summary of all the different components, not all, but some rather, of the different components in green leafy vegetables, how they help protect against oxidative stress, which can lead to metabolic syndrome, help against diabetes, help against the inflammation and oxidation. And this is the last slide. There is this tree of life mentioned in Revelation that it says in the middle of the street of gold on either side of the river was there the tree of life. It bears 12 kinds of fruits, and every month it yields its fruit. And the leaves of the tree were for the healing of the nations. Imagine even in heaven, we still will eat green leafy vegetables from the tree of life to continue healing. Yeah, so why not start now, right? And you know, the Bible is in a sense like leaves from the tree of life, because it's God's word and God is the source of life. So if we also eat spiritually from God's word, we will also, I'm sure, improve mentally, physically, and spiritually too. So that is the end. Do you have any questions? Sorry, I know this took extra long. So it's time for our cooking demo. Let's proceed towards the kitchen.